We are now going to look at provisional restorations and impressions. Here we see the nicely prepared posts positioned in parallel without any undercuts. We're now going to fill Luxatemp into the matrix, always working our way from occlusally to gingivally. We then apply the substance around the clinical situation in the oral cavity very carefully to make sure the rims will all be showing clearly on the provisional restoration. We then place the matrix over the teeth and ask the patient to close the bite to ensure the right height of the provisional restoration. We then use the scaler to remove the matrix before Luxatemp has fully cured. The scaler is very useful to remove undercuts that are harder to reach from the temporary restoration, and then we use the scaler or a forceps to remove the temporary altogether. Here the impression got torn a little when we removed it, but after we have removed the undercuts and protrusions from the impression with old suture scissors, the torn impression can be repaired and reinforced easily with flow. Luxatemp attaches to flow very well within the first 10 minutes, and it cures directly in the patient's mouth. It can also be reinforced further outside. So Luxatemp can be reinforced and repaired anytime with flow. It makes perfect sense to roughly grind the form directly on the dentist's chair with an X-shaped diamond burr, because this is much faster than in the laboratory. Also, the friction inside can be removed easily using this instrument. After that, the impression is sent to the laboratory, because there we can achieve the smooth surfaces much better with slow rotating devices for milling and polishing. Here we're removing the friction, because neither the temporary nor the final restoration must contain any friction, as we will see later. Otherwise, there will be tensile load on the implants, the prosthesis, or the bone. Make sure you remove a bit more material here in the corners. They will be filled with cement, with Duralon later. We can also nicely shape the interdental spaces with a diamond burr. This can be done very fast, and it all happens in the dentist's chair. After that, we send the impression to the lab. Here, in this case, we have to reinforce with flow again, and while the lab finishes and polishes the provisional impression, we cover the edges of the implant very thoroughly here. As we work without a thread here, it's important to avoid any blood or saliva getting in our way and get an exact impression of the edges. If you apply this protocol properly, the edges will be absolutely perfect without having used any thread, without having removed gingiva. Here we have the finished provisional restoration covered with Duralon. We use Duralon for provisional cementing. Duralon can be removed from the implants anytime very easily with a forceps or the crown butler without it sticking to the implant. If some of it does stick, we can easily remove it with ultrasound and a scaler. Do not, under any circumstances, use ketak for temporary cementing, because ketak firmly attaches to zirconium oxide and cannot be removed anymore, except with a diamond burr, but then you have to prepare the implant all over again. You can see here that we wait long enough for the Duralon to become viscous, so that we can remove it in one piece with a scaler and make sure that there is no cement left.